I'll go on mute.
We're just waiting for a couple of our speakers, so give us a minute. I didn't even know that you could have these code names on here. So fun, like Big Poppy.
That's what I just
Yoda. We have Big Poppy. Everybody's got like their stage name. It's great. It's so funny.
That's hilarious.
In the ER, they call me the Coronavora.
Where you put that on there?
So, okay, great. Well, welcome everybody. We're gonna get started in just a minute. And how's the recording? Do we allow recording or?
Yeah, we're opening up recording for everyone.
We're opening up recording. We're on Facebook Live if that's how you're seeing us. We're still waiting for just a couple of our speakers to just hopefully give us 1 or 2 minutes. Thanks for joining us. I really appreciate you making time on this beautiful Friday afternoon. And I'm so excited to have these colleagues joining today for our town hall. So we will start officially and hopefully have lots of time for all of our speakers, and also have a chance for our media partners to ask questions. And the really cool thing is we're hoping to have questions from the general public, which is why we're calling this a town hall, because we know that our communities are wanting to talk to some of our content experts. So I'm glad we got this organized. It took a lot of teamwork, and I couldn't be prouder of my communications team. And I really want to thank Nicole and Brandy from the Fresno Madera Medical Society and from UCSF Fresno for helping us put this together as well. Are we on with Dr. Gomez is on? Great. Hi, Jim. Great. Thanks for joining us. And I think, are we still waiting for Dr. Peterson?
Yeah, it looks like I don't see him unless there's a phone there that there's no ID attached to it.
Okay.
So do you want to start, and hopefully he'll join in? I think he's towards the latter part.
Okay, yeah.
Could we give just about 2 more minutes? I'm unlocking record for everyone.
Okay, yeah, that sounds good. We will start. I'm just waiting for my communications team to give us a thumbs up about the recording, and then we'll go ahead and begin our COVID-19 virtual town hall meeting over Zoom and Facebook. Thanks again for joining us.
Okay, Dr. Vohra, can you guys hear me? Dr. Peterson is having some technical difficulties, so let me send him, let me resend him the link, okay?
Okay, yeah, that would be fine. Yeah, or if he needs to call in, that's fine as well.
I think he's on the phone.
Trying to call in? Okay.
Let's see.
That might be
Hold
him.
on.
That might be the 903 number.
Yeah, he's on. He's on.
Okay. Hi, Dr.
So
Peterson.
can you guys grant him?
Yeah.
Could he unmute himself? Does he have that? Did you guys give him that capability?
Yeah, he should be on.
You guys hear me now?
Yes. Great. Thank you.
You hear me now? Okay.
Yes.
Thanks. Yep.
I hear you.
Sorry, my home internet went down just at the right time.
Totally understand. All right, are we ready to start recording? Okay, well, I think we'll go ahead and get started. Thanks everyone for coming. Like I said, this was a real team effort. It took a lot of organizing, but I'm so happy that it came together. Welcome to our COVID-19 virtual town hall meeting. This really has been a collaboration planned with partnership from the United Way Foundation, Central California Faculty Medical Group, the UCSF Fresno, and community medical centers. the Fresno Madera Medical Society, and the Fresno County Department of Public Health. So I'm so glad that all of these partners have been able to come together. We really have several purposes for organizing this town hall. First is to keep our public and our communities informed and also engaged. We know that this is a difficult time, a time of much information and a lot of different efforts that are being done by so many different agencies and partners. And so we just wanted to share all of our progress on community-wide efforts to prevent spread and to treat patients here in our county that have been affected by the COVID-19. We wanted to give you the best information about how to keep yourself and your family safe during this time. And we really wanted to showcase the creativity, resourcefulness, and the compassion of our healthcare workforce because I couldn't be more proud of the partners that I get to work with every day. And I really just wanted them to have a chance to really share their own roles and their own work in helping to make progress here locally with the COVID-19. Just to give you a sense of what's ahead, I'll just share the case counts like I usually do on these sessions, and then I'll just share some public health updates. I promise I'll make it short today, and then I'll introduce our speakers, and then they will each also just spend a few minutes talking about their specific roles during this pandemic response. And then we'll leave a lot of time for our media partners as well as our communities to really ask us the questions that they have and whatever is on their mind, so that I hope we get a robust and productive discussion by the end of this afternoon. So the total number of cases.
Is still here.
Oh, and please mute yourselves. Although it's great to hear the voice.
Why the Willoughby still here? Why?
We'll go ahead and start with the case counts. And the total number of cases is 443. That includes 44 travel-related, 167 close contact, 195 community spread, and 37 which are still under investigation. The total number of deaths remains at 7, and the total number of hospitalized patients, either currently or in the past, is 90, and the total number of recovered patients is 157. We've got a total test count of 5,759 that have been conducted across the county. The current number of hospitalized ICU patients is at 20 across all of our different medical facilities. We've had a lot of meetings and a lot of discussions this week with all of our partners here at the Department of Public Health. We've been in discussions with skilled nursing facilities and elder residential facilities. We've had a lot of progress made with our homeless accommodations. We've really discussed protocols related to jails and incarcerated populations. We've also talked to employers and businesses, community-based organizations, faith-based organizations and churches, as well as schools. And all of these discussions are really just ongoing conversations. We learn from our partners and stakeholders, and they teach us what we can be doing at Public Health to help support and safeguard the health of the community. There's a lot of talk now about how and when to modify or ease some of the stay-at-home orders and get to what's I think everyone is calling the new normal. I think these are very important questions to be having. And although we don't have a date yet set for a statewide easing of those stay-at-home orders, I think we do have some good progress being made about the processes that it will take to kind of get us to a new, safe, sustainable way to carry on so many of our business functions, so many of our social functions, and eventually bringing all of our institutions that are currently closed back online, such as our schools, our churches, and some of our community organizations. So those are all discussions that we have continued to have. I'm sure we're going to deepen those discussions in the days and weeks to come. More recently, we've had a lot of great discussions with our hospital partners and our medical providers. So I think one very early change that was made by the governor is to allow some of our elective and non-urgent surgeries to proceed, just to make sure that our healthcare is getting back online as fully as possible. And we think that that's a good sign that will allow us to really see how well we can start to ease and modify some of these stay-at-home orders and really change the way that we're doing healthcare and really treating people. Our hospitals have also been great partners for us as we really look at 4 different areas in healthcare that we have to pay mind to as we move forward. And this is really on a day-to-day basis. We have to look at these issues. And that includes surge, meaning how will we know whenever we have what's known as a peak or a surge, and how will we communicate among the hospital partners. I'm very proud of all the work and the planning that we've done. I think we have great plans in place if and when that ever happens. Supplies, meaning personal protective equipment and other supplies. Questions related to staffing, and again, how to protect our staff. We know that our number one asset is all of our healthcare workers, all of our first responders, all of those folks in all of the essential industries that are progress in the biology and really our current understanding of this disease, which seems to be changing every day. So with that as the framework, I really would like to start introducing some of our speakers, because on all of these topics, we have great experts, and I'm so glad that many of them have joined us today to help us really explore deeply some of these issues that I've brought up. And so I'll go through it and just mention all of the speakers up front, and then I'll introduce each one of you to kind of speak about your topics, if that's okay. And by the way, somebody's asking if recording is allowed, and I think that the answer is yes.
Yes. Mm-hmm.
Yes, recording is allowed. So our participants, and this is not necessarily the order that they will be speaking, but just to let you know that they're on. We have Dr. Eyad Almasri. He's a associate clinical professor of medicine at UCSF Fresno, and he specializes in pulmonary medicine. He's been a friend and a mentor, and he's just one of our great intensive care and pulmonology physicians. I'm so glad that he's here so that he can answer questions about this clinical illness. Then we have Dr. Jim Gomez. He's the chief of emergency medicine and clinical professor of emergency medicine at UCSF Fresno. Jim is an amazing physician. He's been my chair for many years, and he's a great humanist and a great mentor for me. So thank you so much, Jim, for making time to come on and to talk about the emergency department response at Community Regional Medical Center. We have Dr. Elieth Martinez. She's the assistant clinical professor of internal medicine at UCSF Fresno. She's a familiar face. She's joined us on our media sessions before, and she's been doing a lot of outreach to help make sure that all of the communities who need to get important messaging about prevention and treatment with COVID are getting those messages. So I'm glad that she's been able to join us today. We have Dr. Michael Peterson. He's the Associate Dean and Professor of Internal Medicine at UCSF Fresno. He's also a specialist in pulmonary medicine. And really, he's been our leader for medical education throughout the Valley. And he has really spearheaded so many educational efforts and continues to champion the very important needs of establishing medical education here in the Central Valley. So I'm really glad that he's joining us. Dr. Tom Utecht is Senior Vice President and Chief Quality Medical Officer at Community Medical Centers, also a specialist in emergency medicine. So thank you, Dr. Utecht, for joining us. And we have Lindsay Callahan. She's the President and CEO of United Way at Fresno and Madera counties. and she's joining us to talk about how community resources and community-based organizations are playing such an important part in the response to the COVID-19 epidemic. I've already mentioned Brandy Nikaido and Nicole Butler. They're helping us with the communications, and they've been instrumental partners with making sure that important messaging is getting both out to the public and also coming to us so we can know exactly what the general communities as well as our media partners want us to speak about. Like I said, communication is such an important to every response in a complicated pandemic like this, and so we really appreciate everyone being able to come together on short notice like this. Well, I think we'll have Dr. Almasri speak about the current understanding of COVID-19 and maybe just talking about the biology of this illness and also how it really presents in real life. So if you're able to see his slide set, you can see that he'll be speaking about the biology of this COVID illness. Go ahead, Dr. Almasri. Hopefully your mic is working.
Can you guys see my slides and hear my voice well? Okay, thank you. To start, this is my objectives from today. I have only 5 minutes and I'm not going to read them. This is an emerging disease. So we know what we know so far, that it emerged from the reservoir, which is the bats, and somehow it reached humans. In between, there was probably an animal known in China as pangolin. This animal is in the endangered species, and in China it's sold in a black market. It's probably one of the most trafficked endangered species. And they use it for medicinal properties in traditional Chinese. Started in Wuhan, China, and we know for sure. And at the beginning, it was called Wuhan coronavirus. However, due to very similarities with old SARS virus, the International Classification Committee decided to call it CoV-2, which is the official name of the virus. You probably know, started in Wuhan and ended up in the whole world. And this is, I just took this from Johns Hopkins dashboard about an hour ago or less, and we are approaching 3 million cases in the world, and probably we're hitting close to 1 million in the US very closely. So back to the classification of the viruses, roughly we have 6 or 7 kinds of classification. It's called Baltimore classification, and this is after David Baltimore, not the city. So we have single-stranded DNA, like in the herpes. We have double-stranded DNA, we have double-stranded RNA, and single-stranded positive RNA viruses, and we have single-stranded negative RNA viruses. What we really care about here is the class 4, which is single-stranded positive RNA viruses. An example of those is the common cold virus that causes yearly infections. We have the polio that is almost extinct, and you all know the coronavirus here of interest. Interestingly, the coronavirus is a single-stranded RNA virus, but it is probably the longest RNA genome known in this class, and this may play a role in its pathogenicity. Quickly, the virus has the genetic material, which is single-stranded RNA, but also has 3 proteins and lipid layer. The lipid bilayer is the one that is affected by soap, and here comes the hand washing. The protein S is the one that plays role into hooking into receptors, ACE2 receptors into our bodies. This is from CDC website. You all know it starts as usually fever, cough, shortness of breath. I don't see most of those people. I only see people who end up in the hospital. It is ARDS, advanced respiratory distress syndrome, adult respiratory distress syndrome. And it looks typical like all other ARDS that we deal with from other viruses, whether it's influenza, H1N1, or other even bacteria. There is no question whatsoever that this is ARDS by physiology, by x-rays, by how to deal with it. It has some differences, though, that it has higher tendency to cause renal disease, and this emerged early in the disease from our experience in New York. Also, we have elevated liver enzymes and tendency to clot more with this virus. Now, treatment, we have none of the treatments actually for this virus is FDA approved. We do not have any established treatment other than a supportive care and waiting for the patient to improve. That doesn't mean that we're not trying. We are trying hard, and we have passive immunity with convalescent serum that we may have available to us here very soon once we work with the paperwork. But also we have antiviral medications, most of which disrupt RNA transcription, such as remdesivir that we have been using here on an expanded access program. We also are trying many other treatments that was suspected to be helpful, such as hydroxychloroquine, without proof so far. We are in a place where we will probably be trying many treatments in the near future to help advancing this science in this field. The good news about this SARS-CoV-2 virus that it mutates at much slower rate than influenza. So this may allow us, if we can reach the vaccine soon, this vaccine is likely to be effective for years to come. What we don't know, we know for sure, by the way, that this virus started in the wild. It was not created by CIA or Chinese labs or any other biochemical affair. We know also that this virus caused a pandemic, and it's very similar to the SARS 2002-2003. What we don't know, when did the pandemic start? We know it's probably 2019. Most of us suspect that it was before December, maybe probably October or November. The prevalence of asymptomatic patient, we don't know. The more we look, the more we find evidence of previous infections. We also don't know the degree of immunity and how long does the SARS-CoV survive outside the body. We know it's probably more than 24 hours and close to 3 days. And also we don't know whether we will have effective treatment or not. I will stop here, and I think we are leaving the question to the end, right?
Yeah, if it's okay, we'll just save our questions till the end. That way, give everybody a chance to do just a very brief presentation. But thank you so much. That was amazing. Very brief, but in-depth review of the biology and the current understanding of all of the different aspects of this epidemic. Thank you so much, Dr. Almasri. I'm next going to introduce Dr. Jim Gomez. Dr. Gomez is the Chief of Emergency Medicine and a clinical professor at UCSF Fresno. And he'll be talking about how our emergency departments are responding and some of the transitions that we've had to make and that we're currently experiencing as a result of this COVID response. Obviously, the emergency department and all of the frontline workers have been contending with this epidemic since the very beginning. And so we wanted Jim to really speak about some of these issues that we emergency providers are going through. Thanks, Jim.
Hi, Rais, and thank you for the kind words, and thank you for having me, and I'm very happy to be here. Our ER team of nurses and doctors at Clovis and Community Regional Medical Center, we've been planning and preparing for COVID since late January and early February. We've been fortunate in that we've had the benefit of time in early shelter in place while learning from our colleagues in New York City, Detroit, in New Orleans and reading the literature and understanding how things have played out in other continents. We also have an incredible team. In partnership with community medical centers, our overarching guiding principles have been twofold. One, to ensure the safety of the public that seeks our care, and two, to ensure the safety of all of us that work on the front lines, whether that's nurses, doctors, clerks, physician assistants, and nurse practitioners. So with that in mind, we developed early a triage model whereby patients are screened by nursing for COVID before they enter the ER and are placed in a separate area from those presumed not to have COVID. This is not only for our patients that come in by car or walk in, but also for those that come in via ambulance. Those separate areas include a designated zone in the emergency room we call the warm zone, specific resuscitation rooms where we have to do advanced procedures, and yes, downtown we even have a tent. In early March, we operationalized tele-ER visits so that providers could see and speak with patients while being in the ER, yet not necessarily being in the same room. We also created telehealth so that if some of our faculty were ill, they could see patients from home. And thanks to community for making that happen so rapidly. One of the things that we are very worried about is while we've taught the teaching has been for those patients that have COVID to stay at home, recover at home, unless you're severely short of breath, what we're seeing is a significant drop in the overall number of patients that are coming through our ED by 1/3. We are very worried that these patients with serious ailments are not seeking care, that have urgent or emergent complaints, and they've decided to wait it out at home. I just want to say that we are here for you. We are here 24/7, 365 days a year, whether you have COVID or not. We will do our very best to provide expert and safe care. And we can assure you that if you don't have COVID and you come to our hospital, we are not going to give it to you. So thank you very much. And I'm happy to answer questions later on. Thanks, Rais.
Thank you so much, Jim. That was an excellent and heartfelt presentation. And thank you for everything that you do every day to protect all of us and the excellence in care that you insist on as our standard at the Community Regional Medical Center. Next, we have another one of my emergency medicine colleagues, but he's also the Senior Vice President of Quality and the Chief Quality Medical Officer at Community Medical Centers, Dr. Tom Utecht. And hopefully Tom will also talk about how Community Medical Centers is at a hospital and system-wide level, making sure that healthcare workers have all of the resources and support that they need to stay safe.
Thanks, Rais. Yeah, for 2 months, the COVID-19 pandemic has certainly consumed nearly all aspects of our life. During this unprecedented time, we've had our emergency response teams in place, as Jim said, helping to plan to keep our patients, our families, our employees, and physician partners safe, supported, and protected. We keep a close eye on every aspect of this ever-changing situation, but I wanted to focus on 3 of those areas that we're focusing the most on, I would guess you'd say. The first piece is the surge that has been talked about before. At the request of the state of California and Fresno County Department of Public Health, we have executed a plan to increase our ICU capacity by 100%. That's from 120 beds to 250 beds. And our step down and med surge bed capacity by 50%. That's 600 beds up to 900 beds. We're also working with Fresno County Department of Public Health to staff the federal medical station, should that be necessary in the surge. And finally, we do have 25 care locations across the community health system providing telemedicine solutions for our patients. And this is a technology that we are also using in the hospital and the emergency department. The second aspect to focus on is maximizing our personal protective equipment, or what's known as PPE. and that's protecting our workforce and our patients. Our employees are our greatest asset, and we place their safety as the top priority at all times. This is certainly most important when we're working with an infectious disease such as COVID-19. We are doing everything possible to make sure that our staff have the appropriate personal protective equipment. In response to Fresno County's Department of Public Health's directive for universal masking, we implemented universal masking last week so that all folks that enter one of our facilities where patient care occurs are required to wear a mask at all times in patient care areas and applicable common areas. Just to note, that has increased our typical mask usage of just our surgical and N95 masks is roughly 5,000 per day, and moving to the universal masking has increased that to 15,000 per day, so a significant increase there. We're very thankful that we've received donations from the community for handmade masks, and to date we've distributed 3,500 of these donated cloth masks. Also on the PPE front, the N95 respirator masks, we're able now to reprocess using a hydrogen peroxide technique. We began that process this week, and it's a slow ramp up, but we're happy to say that we've done a reprocessing successfully of 200 of these masks and hope to be able to do 1,500 on a daily basis in the next couple of weeks. And we certainly continue to engage with our federal, state, and local leaders to explore every option possible of procuring PPE. Lastly, the last focus I'll mention is expediting tests. We have now in-house testing, so we have that equipment and supply to process over 500 tests per day. We hope to increase that number to accommodate up to 2,000 tests per day, although that certainly requires the necessary equipment and reagents to be delivered. So that's a brief summary of where we are at CMC, and happy to talk more during the question and answer session.
Thank you so much, Tom. That's so fantastic. I'm so glad to hear about all of that progress. I know that your team has been working tirelessly to make that happen. That's none of that is easy to do, and all of those projects took many people spending many long hours. So thank you for that. Next, I'd like to introduce Dr. Michael Peterson. Like I said, he's our Associate Dean and a Professor of Medicine. We really look to him as the champion for medical education for the whole San Joaquin Valley. And he's going to be talking about the UCSF Fresno Medical Center's efforts with outreach related to research, as well as how we're connecting with our main campus partners at in San Francisco at UCSF, Maine, and also how we're protecting all of our trainees who are UCSF Fresno residents and fellows. Dr. Peterson?
Thank you, Dr. Vohra, and thanks for the opportunity to participate in your town hall. I'm pretty sure I'm the most mature physician on this group, so I've had the longest career, and I have to say that I've never been prouder to be a doctor than I am during a period of time like this when a crisis comes forward and I get to work with people like everyone is hearing about today, as well as working with trainees that are absolutely committed to the Central Valley and to the care of their patients. This is why we all went into medicine, and this is our time when we're called on by the community. So again, I'm really proud to be a member of this group. We all know, I think, that we have historically suffered from a shortage of physicians in this region of the state, and we were put here 45 years ago to help to address that in terms of training physicians, and we are the largest training program in the Central Valley, with major affiliates being Community Regional Medical Center and the VA, as well as a number of other sites where our residents train, and we're a safety net provider for the region. And as I think people are learning, this is a pandemic which is unevenly affecting our populations, and those populations that don't have jobs where they can shelter at home and don't have the same kinds of resources are being disproportionately affected by this pandemic. And these are the very patients that we are focused on helping to provide care for. One of the things in terms of medical education that I think this opportunity presents itself in a real way is for physicians to learn more about public health. Now, we have talked for a long time about the fact that physicians historically have not had a lot of training in public health. And here our trainees, as well as trainees around the country, are getting an immersion in the education of what public health is, what an epidemic and pandemic is, how you prepare for these kinds of things. So it's been, a tremendous learning opportunity for them while they're providing this service. One of our focuses, of course, is, we don't have enough physicians and other healthcare providers in our region. And we want to make sure, just as Dr. Utecht said, that we are focused intently on the safety of our faculty and our trainees, making sure that they are protecting themselves while they are providing care. One of the things that trainees, they are learning how to do these things, and even the simple steps of how do you put on personal protective equipment, to making sure that they are trained well, that we are using a buddy system for them so that when they do have situations where they have to have personal exposure to patients with COVID-19, that we're making sure that they are fully protected. In addition, as Dr. Almasri pointed out, we don't have any effective treatments that we know about for this virus yet. What he didn't tell you is that he's helping to lead some of the research programs here, making various treatments potentially available to patients in the region. And again, these are research studies. We don't know that these treatments will work or not work. But as he pointed out in an earlier conference I had an opportunity to participate in earlier today, that our colleagues on the East Coast are looking to us on the West Coast to be able to do some of this research, because we're not so fully inundated with the clinical care that we actually have the time to do this. So I really want to recognize the groups both on the ED side as well as the critical care side that are really taking a lead in this. In addition, I participate multiple times each week in conference calls with the UCSF main campus, so that I am fully knowledgeable about resources that they have and are willing to share. One of those being something that I hope we can start to take advantage of is they have a very large research facility called the BioHub, which during this period of time is they've shut down their research and they have converted that completely over to doing tested for COVID. And they announced last weekend that they will provide COVID PCR testing free of charge to counties in California. So we hope to work with Dr. Vohra in the future, figuring out how we can use that resource to be able to enhance what we can do in our local community with laboratory testing. I think anybody that's been watching the news at all over the last couple of weeks knows that testing is going to be one of the keys to getting us back to anything close to a normalcy, especially on the economy. So again, I really appreciate the opportunity to participate in this town hall and look forward to answering any questions that people have.
All right. Thank you so much, Dr. Peterson, for that fantastic update and for all that you're doing to help connect all of these various different experts from all over the country and all over the state to help our county's residents. Our next speaker is Lindsay Callahan. Lindsay is the president and CEO of United Way of Fresno and Madera counties. She's been a real champion in making sure that community resources and community organizations are able to have a big impact on this response. And so please give us an update about the kinds of projects that you've been able to help with, Lindsay.
Absolutely. Thank you so much for having me. It's my honor to be a part of this town hall. And as I believe the only panelist without an MD, I really appreciate being on this very esteemed panel, and especially appreciate the leadership from you, Dr. Vohra, and the rest of your team to understand that this is obviously a health crisis, but that this health crisis is also creating this additional crisis, this financial crisis, mental health crisis, and really just a hard time for humanity. So my organization, United Way Fresno and Madera Counties, has been working to really step up with our community partners, many of our community partners, to provide additional resources and to really address this crisis that's happening right now. One of the things that we recognize is that community members are experiencing a high level of information overload at this point. There's a lot of things that are coming, there's a lot of information coming in, and information is changing on a regular basis. So to try to help address that, we are creating ongoing updates on our Facebook page. We also have a COVID-19 resource page, but probably even more important than that, you don't even have to track a list. United Way Fresno and Madera Counties offers a 24-hour, 7-day-a-week helpline. It's called 211. If you haven't heard of it before, it's very simple. It works just like 911 or 311 or 411. You just dial 211 from your phone, and you'll be connected with one of my call specialists who is specifically trained to provide you information about anything from COVID-19 resources to any other question that you might have. If you have needs around food, if you have needs around getting to a health facility, if you need help with delivery of food, if you're having a financial crisis, if you need to find out where the nearest resource is related to mental health, then we can also provide that as well. This type of resource is constantly changing, as I mentioned, and we're providing this service obviously free of charge. It's also confidential. We're getting a lot of questions right now about rental assistance and support around paying rent and staying in housing. So we're also trying to keep up to date on that. I'm hoping that people understand that because things are changing on a regular basis, our information is also changing. So one day you might call, and as we all know, there's different things that are available on a daily basis. So just because you call one day and there's no more rental assistance, the next day we may have a resource that can find you assistance on that. So really kind of keep up to date and keep plugged into 211. One of the other major things that United Way is doing to address this crisis is we have established an emergency relief fund for COVID-19. So folks who have been, and this is specific for individuals and families in Fresno and Madera County who have been impacted by COVID-19. So if you have had some kind of impact to your pay, to your employment because of the coronavirus, we have a fund that we've established where we are providing $500 in cash aid. We know that that's not enough to get you completely through this crisis, but we're hoping that that amount of money can be some kind of short-term fix until we're able to all get back to work and be fully employed. Right now, we just closed our first round of applications for that process. We gave out about 100 cash aid gifts, and we're getting ready to roll into the second round. So if you would like more information about this, you can visit our website, uwfm.org, or you can, even better, follow us on social media. We are constantly posting updates about our funding and about our different resources. The other way that you can stay updated about all of this, from our relief fund and getting cash assistance, all the way to figuring out how to get home delivery of food, is to text coronavirus, you would think I could say it by now, to 211-211, and you will get regular updates on everything from food deliveries, as I said, to other opportunities, like if we have a diaper giveaway or things like that, and obviously updates on our relief fund. We're very proud to be able to support the community in this way, and we're very grateful for all the corporations and the individual donors who have given us the support that we can provide back to the community to help us get us through the situation. We have lots of partners who are standing behind us. This is the only reason that we are able to do what it is that we're doing. everyone, I want the community to know that there are lots of organizations and people who care about your well-being and are working and fighting on a daily basis to make sure that you're both safe and healthy, and we try to help you get financially secure.
Thank you so much. That's really amazing. Such a vital set of resources, from the helpline to the all of the different projects that you shared. Thank you for your generosity, for your leadership and your vision. We really appreciate everything that you and your team are doing with those projects. I'd like to next introduce Dr. Elieth Martinez. Dr. Martinez is a specialist in internal medicine. She's also very passionate about outreach to our communities and education of the public. She's been instrumental in really making sure that messages are getting out to people that may not necessarily speak English, or be the main consumers of the mainstream media. So I just want to give her a chance to talk about some of the ways that she's been able to innovate in this very important aspect of making sure that every single member of our community gets the good messages that they need to hear during this time.
Thank you, Dr. Vohra. Over the past month and a half, we've been doing a significant amount of outreach in the community of Fresno. Just to give a couple of examples, just last month, representing UCSF Fresno, I was invited by the Fresno City Council, an invitation by Council Member Soria, California State Assembly Member Dr. Arambula, to join other community leaders to answer questions not just in health, but also in commerce and education. And this was in an all-Spanish town hall, and we had a great turnout too. I've also participated in interviews and participated and partnered with our Spanish media stations, specifically Univision, to answer any questions and clarify any questions given the changing landscape that we see every single week here. Our most recent and exciting project includes this partnership with the Fresno Department of Public Health, for which in the next couple of days, folks in the community will be seeing a series of multilingual infomercials in order to educate not just the Spanish community, but also the Hmong and Punjabi speaking community. And we're currently working on other projects at this point, but those are just a few examples.
That is so fantastic. I've said this before, I think one of the real strengths of our community is our diversity, and it's really important at this time to really reach out to all of those populations and make sure that they have all the support that they need and all the information they need to keep themselves and their families safe. So thank you for doing that, all that you're doing with that, Dr. Martinez. And our final presenter today is actually my colleague, also a professor at UCSF Fresno, but he's the health officer in Madera County, Dr. Simon Paul. And I really wanted him to speak about public health and some of the responses that, the health officers like myself and our peers are thinking about, just in terms of the governor's roadmap to recovery, easing or modification of some of these orders, and how we think about all of that information overload that Lindsay was talking about, and how we actually frame that into actionable items.
Great, thanks. So Madera has actually been an interesting sort of case study of the effects of all the efforts that the public have been making in this area, staying at home and social distancing and all of that. We only have a total of 36 cases, but the timing of the governor's stay-at-home order happened very early in the spread of the COVID-19 into this area. And since then, since the imposition of that order, we've only had about one case every 1 to 2 days, leading up to a total of 36 cases since the very first one was diagnosed. And several things, in addition to the stay-at-home order, have also been effective at helping us keep the virus under control. We work very quickly with the Sheriff's Department, the deputies, to scale up contact tracing. So in addition to reassigning staff within the Public Health Department and working with the Sheriff's deputies, we've been very effective at being able to track down all contacts and stay in touch with all people that are in quarantine or isolation. The Sheriff's deputies actually love tracking people down. If anything, they're almost too effective at finding contacts. They work 24/7. And if somebody needs to be put in isolation or quarantine, they do very well at it. So I mentioned that I thought this started the stay at home early in the epidemic here. And part of the evidence for that is from our community providers. They tested over about 150 people who presented with fever and cough, and only 1 out of the 150 actually turned out positive for COVID, whereas in other areas of California at this time, people were seeing numbers like over 10 to 15% of patients presenting with fever and cough. So that's been great to date at controlling the preventing spread of the virus in this area. And the question is, where do we go from here? And part of the problem with this having been so effective is there's a lot of frustration in the community, especially in the business community. We've seen almost no cases. We're seeing one every couple of days, and it's having huge financial impact on all the businesses in the areas. And it's not quite clear in a community that hasn't been impacted like here, like in other small counties on the eastern side of California and up in the north, what we're waiting for before opening things up based on the governor's roadmap. The one thing that is going to change in the next month is the availability of testing. We've actually been able to test most people who, are sick or need testing or wondering out if they're having COVID. But as far as keeping an eye on things as you open up businesses and get more movement in a county, to be able to prevent and to catch early if there's an increased incidence of COVID-19, you really have to start having much more widespread testing, which is something Dr. Vohra has talked a lot about, being able to test in communities that may not have access, communities before. You don't want to wait until people are showing up in the emergency room and in the hospital, because at the time that happens, you can have many more cases out in the community that are going undetected. So we've been very fortunate with many of the things that in roadmap. We've been able to scale up contact tracing. We have guidelines for businesses to reopen. What we're trying to do is go away from this essential, non-essential idea to focusing on what's safe and what's not safe and try and get businesses on track with that. And we're also, as we move forward, the one other big benefit of this month with everybody staying in is everybody now knows the behaviors they need to maintain to sort of protect themselves, whether it's the distancing, whether it's using face coverings, avoiding crowds, mass gatherings. So I think reinforcing that as things open up and having a good ability to do surveillance testing is really the key to the next steps in the roadmap for areas like this that haven't been greatly affected. Yeah, we have surge planning and stuff like that, but that has not been a major problem in this area. So the next challenge for us, like I said, the contact tracing, the home isolation has worked very well to date in this area. And the question is, as things open up, again, has it been almost too effective? People are feeling that things should open up more quickly than they can. So that's where we're at here looking forward.
Yeah, and Dr. Paul and I have reviewed 3 apps just today that are smartphone-based solutions for contact tracing. So this is moving very quickly. I think all of us are going to hear more about how contact tracing can be automated, can be made more efficient, just so that we can be very effective at doing it, because that is really the best strategy that we have at containing all of these cases before they turn into clusters, and keeping these clusters as small as possible so they don't turn into outbreaks in different communities. So thank you so much, Dr. Paul. Really appreciate your insights. Again, your continued knowledge and mentorship. I really look up to you for a lot of the guidance. And like you said, every county has a little bit different situation, just depending on what resources and what challenges that we have. But it's always good to learn from our peers and really talk through some of these very important issues as we make some of these decisions moving forward. So thank you all. Thanks to all the speakers for really going through just a whole range of different issues related to this pandemic. Really appreciate all of you making time and also compressing what you do into such short presentations, because I know that really belies the many, many hours of work you've done just in the last 5 or 6 weeks as this pandemic has really changed and disrupted so many of our lives. And we really appreciate your ongoing efforts to help keep everyone in our community safe. You certainly have my gratitude, and I'm sure I speak on behalf of really all of our whole region to say that we really do owe a huge note of thanks to all of our responders, public health experts, healthcare leaders, and community organizations for keeping us as safe as possible. So I think we'll go ahead and allow some open questions, and I'm looking to my communications team to see exactly how we should proceed. I think, should we just go ahead and allow people to unmute and maybe ask questions over the Zoom, and then also we'll just we'll try to field questions from Facebook if you're following along on Facebook. Sorry if you're having some technical difficulties, but hopefully the Facebook will come online if it's coming in and out. Yeah, feel free to unmute yourselves if you're on our Zoom, and really just ask any of our content experts any questions that you might have.
Dr. Vohra, Corin Hoggard here. Can you hear me?
Hi, Corin. Yes, I can. You got a good connection today. So
excellent. I put myself as your third biggest fan, bronze medal.
Oh, thank you.
I'm sure you have two other bigger fans. I have a series of questions about testing, basically, and I know that there are some experts here that can probably help, Dr. Utecht, for example. But can you start by telling me what labs are actually processing the tests here now and how many tests they're processing? I think Dr. Utecht said it was 500 that community is able to test now. Is that testing and lab work?
So that is correct, and we are currently testing in-house both at our Clovis campus and at CRMZ.
And then we have, is it accurate to say the Fresno State Lab is up and running doing 40 to 60 tests a day?
It is, yeah.
Okay, and then are there others?
Well, yeah, there's the private labs like Quest and LabCorp, and they do, I would say, on the order of hundreds of tests a day from throughout the county. Those don't get run in the county. They have to be sent out of county to get run at one of their major hubs. And so they're actually doing thousands and thousands of tests in a high throughput capacity kind of way. But we're estimating that a few hundred of those are coming from Fresno County just based on the numbers that we get back. And then, different hospitals, we don't have anyone from St. Agnes, but we talk to them just about every day. St. Agnes has in-house testing. Kaiser Permanente has in-house testing as well. So we're very proud of how our hospital partners have risen to the occasion, been very aggressive about getting that in-house testing done because they know that that's the best way that they could ensure a fast turnaround time for their high priority patients.
They're doing the tests and the lab work.
Yes, that's right. And the real bottleneck, and I've mentioned this before, is not even the reagents and the machine that run the specimens. It's actually those darn Q-tips. It's really hard to get those Q-tips that you actually use to do the swabs, and those are in very short supply. We think that shortage is actually easing up, and that there's more and more coming down the line. That's been the story for this week, but it could change next week, and so we really have to take it week by week. We've actually requested 45,000 of those Q-tips from the state. We just put in a huge bulk request and we said, give us as many as you can because we know that we're gonna use them sooner or later. I think I've used this estimate before, but we're estimating that we need about 1,500 tests per day to safely and effectively really reopen all of Fresno County and feel safe that we're testing enough people. So that's a big number. Oh, go ahead. Yeah.
It's kind of leading into that question is what is our supply for those Q-tips and these tests? Does it come from the state?
Well, there's a lot of different vendors. For example, some of the private labs will actually supply their own. They have their own supply lines. The state has actually designated Fresno County to be one of the sites for one of their high throughput labs. And that vendor is called OptumServe. You're going to be hearing more about that next week once we get online with that. But they actually will bring their own PPE and lab tests and lab kits. And so we're very thrilled to have that. And that's going to allow us to do another 100 or so tests here in the county. And they will come with their own lab supplies, including the test kits. So we're really pulling from all corners and making whatever adjustments we need to get this testing done.
One last thing related to that. So the state of California jumped from about third worst in the country to middle of the pack this week. Huge number of tests. But here in Fresno County, the number of tests you guys are doing has remained about the same for the last 3 weeks now. Is that accurate? And when are we supposed to get, our big outburst?
I would say I think we've slowly expanded our capacity. More importantly, I think we're testing appropriately in that we're really following the evidence-based guidelines that are put out by California Department of Public Health and the Centers for Disease Control and Prevention. So I'm actually, I won't say that I'm satisfied, because I feel like we still need to get more testing done. But I am happy, given that resource shortage, just how well our providers have done in selecting the right patients, making sure that we're addressing symptomatic patients, which is of course the highest priority, but also testing asymptomatic patients at high risk, making sure that we're protecting our healthcare workers, making sure that we're protecting those who work in public service that are first responders and law enforcement officials and public servants. And so, and on top of that, we're doing more surveillance testing. So really we're hitting all of these different priorities. I'd like to get more testing done in each of those, especially the lower priority ones. But I feel like the high priority cases, the folks who are hospitalized, the folks who are very symptomatic, the healthcare workers, those are all getting the testing that they need to get done. And so I have to say that given the resource limitations that we have and the fact that we can't really control all aspects of this supply chain right now, I'm very happy with what we've been able to achieve so far.
Who gets the tests when we go from 150 to 200 a day to 1,500 a day?
Well, really, I mean, you know, the priorities, again, are kind of set at, you know, the folks who are symptomatic, the folks who are the most vulnerable. I like to say high chance of getting it, high chance of passing it on, meaning people that work in the front lines of public service, the people who have the highest chance of having complications or death. Those are the folks who need to be prioritized, and we have to know right away whether or not they have the COVID infection. And then beyond that, the priority level changes all the way from that to, you know, basically doing surveillance testing out in our communities just to catch these outbreaks before they even become symptomatic. So basically testing totally asymptomatic populations to just get a baseline for what's going on out in the community. Those are kind of how the priorities are set. And I think that's where we'll go, and we'll be able to expand the lower priority testing while at the same time making absolutely sure that the high priority testing is reserved for the really quick turnaround tests that come back, you know, within a couple of hours. Has that been your experience, Tom? Is that some of the higher priority testing is coming back really as soon as a couple of hours?
Yeah, absolutely.
I have surveillance testing questions too, but I don't want to monopolize this. So
virus task force meeting every day.
I'll let other people talk.
Okay, well, thank you so much for those questions, Gordon. I appreciate you you asking that. Anyone else ready with a question?
So in case nobody, now I know it's none of my listeners. None of my listeners.
Sounds like somebody's doing a radio broadcast. Thank you. We appreciate really all of our media partners. But please remember to mute yourselves. There is a question that's coming through on our text, and I'll just go ahead and ask it. Is there a plan for serum testing for the community at large to identify exposure to people who have never exhibited symptoms? And I'm going to point that one to either Dr. Paul or Dr. Almasri. What are your thoughts about doing serology testing to identify people who have never exhibited symptoms?
I think it's going to be very helpful in the short term just to get a sense of how much is out there. And that's what you've already seen. In other counties, they see like 5%. In New York City, they saw about 15%. But that's a population surveillance study. I think at the individual level, it's going to take a while before we have enough data to know what the tests mean. Many of the tests haven't been validated. We don't know what immunity means. We don't know how much immunity you need to be protected from infection. So I think at the individual level right now, it could be very misleading. But over the next few months, we may learn an awful lot and it might become much more useful. So in the short term, I think it's useful for surveillance, but not for sorting out individual cases and are you at risk for catching this or not.
Great.
If nobody else wants to ask anything, you guys did surveillance testing in Selma last week and Wrigley yesterday. Did you get results in Selma? I only saw the case count there go up about 4.
Yeah, and we did catch I think 1 positive case as a result of our surveillance testing, which was pretty interesting for us. Obviously, whenever we have a positive, we embark on our aggressive contact tracing right away. So we reached out to that patient. We made sure that they were aware of their diagnosis, that they stayed in isolation, and then we also communicated with their close contacts to let them know that they had to quarantine, just to let them know that they were at a little bit higher risk of catching the COVID infection. That was very interesting. The results from Reedley are not back yet, but we're going to continue to do that surveillance testing. We learn a little bit more about how to refine that process every time we do it. And we're so grateful that we have partners such as Adventist Health, Valley Health Team, and the United Health Centers that can help us perform that surveillance testing in all of the primary care areas in these rural areas. So yeah, we'll continue to update more about that surveillance testing project as we get more experience.
I have a question, if
Yes.
that's okay. This is Mary Johnson, Coalinga Press.
Hi.
And my question is, many residents out here, we're in an outlying community, and many residents are curious to know when they might be able to take a test or take advantage of testing, even though they may be asymptomatic because they've either come into contact with
Yes.
someone who they suspect is one of the people who have it. So
Thank you for asking that. That's exactly the whole aim of surveillance testing, is that we want to target our rural communities where testing may not be done to the level as needed. What's great about this testing that's coming from the state with the high throughput testing project is that people will actually be able to come get that test done. It'll be very, very high tech. They'll be able to sign up online, and then they'll be given an appointment, and they'll be able to come get that test done, and then the test result will be relayed to them as soon as it's ready. So that's one mechanism that they can use, and that will be hopefully ready in about a week's time, is what we're being told by the state. And beyond that, we are planning to come to different rural areas, and so hopefully we'll be near or in Coalinga in the days and weeks to come, and we can definitely test people at that time as well. So yeah, that is exactly the point of all of this surveillance testing, is to let our rural communities know whether they're experiencing this COVID infection, even if they're not feeling symptoms, because we know that asymptomatic infection is happening. It may be driving a lot of this community transmission, and we won't know unless we check. So that's exactly what we plan to do.
thank you so much.
Sure.
I got a question.
Go ahead.
This is Thaddeus Miller with the Fresno Beat. Dr. Gomez said something about patients who need to go to the ER waiting too long, and I believe that was Community Medical Center. Is anyone at UCSF seeing something similar?
Go ahead, Jim.
So UCSF and CRMC, we are the same. So I have many different hats. I'm the professor of emergency medicine and the chief of emergency medicine at UCSF Fresno. I'm also the chair of emergency medicine at Community Regional Medical Center. So when I speak on behalf of CRMC, I'm also speaking from many different hats. What I was alluding to is we are worried. I have nothing to prove. I'm worried that patients that don't have COVID are not seeking out care because they may be afraid of coming to the hospital, because they may be afraid of getting COVID, or they're just afraid that they don't know. And so I was trying to provide some reassurance that we are providing a safe space for them as well, based on the way we are triaging people from our nursing before they enter the emergency department. Does that answer your question?
I think so.
I would just like to echo my emergency colleagues' response too. I work in the inpatient side, so any patient who's being admitted from the emergency medicine side, stable enough to be on the floor, but not sick enough to be in the intensive care unit. We've also been seeing this. Some of the patients that we've been taking care of, they're coming in because they have not refilled their medications. They're not going to the pharmacy. They're not going to their primary care appointments because of that fear of contracting the virus. And so, pre-COVID, we were seeing quite a bit amount of sick patients in the emergency room and also in the hospital itself. And so just to echo those thoughts, I'm very concerned about these patients who do need to seek this emergency medical care, but are sort of holding off until their condition may worsen. And so that's part of the outreach too, in order to communicate that message that it is safe to come into the hospital if folks need emergency care.
Yeah, the hospitals have done a fantastic job. Really, all of the hospitals have really risen to the occasion and set up areas that can take care of COVID positive patients, but also the non-COVID patients. And they've made absolutely sure that their staff are safe and that patients are kept safe as well. So if you've gone to the emergency department before, it may look a little bit different. They're gonna have more processes in place, but they absolutely are able to take care of anything that comes through the door. That's still obviously the bedrock philosophy for emergency medicine that hasn't changed during this pandemic, even though we've had to make changes throughout our hospitals in order to make sure that we're keeping everybody safe. So please, if you are ill, please seek help. There's telemedicine connections that you can now do, which we've never had before, and they're better than ever now. So I think that's one of the great things that has come out from this pandemic, is that we've really been compelled to level up our ways of communicating with our patients and with each other. And this Zoom connection is an example of that. But there's many other things that we're doing to make sure that we're reaching out and staying in touch with our patients. So please definitely take advantage of all of these different communication strategies that we're using. But really beyond that, if you need to be in the hospital, if you feel like you're getting more sick from anything, then definitely don't hesitate to come to the emergency department or contact your primary care doctor. Question from the Facebook feed. This is actually a really interesting question, and I'm curious myself to hear how our experts will respond. And this is basically that the national experts have mentioned that we should expect a surge in the winter similar to influenza, and whether we expect the coronavirus, the COVID-19, to have a seasonal sort of pattern. And if that's the case, what preparations are being made in Fresno and also Madera County? So I don't know, Dr. Almasri, have you given much thought to the seasonality of this COVID virus, and what's your insight into this?
I think this is to be expected, and it is fair to say, and this is why we are ramping our effort to learn as much as we can. So I think what we will end up with, instead of having one acute surge, the modeled after New York or Detroit, I think we will have probably increased level of respiratory illnesses throughout the summer, and maybe another peak in early winter month. This is what happened before with similar viruses, and it is fair to expect that. And I think also we need to keep in mind that what was feared in the past, we haven't seen. So what people reported of 70% mortality of all patients who got intubated did not hold true when we actually put it to test. When we are not overwhelmed, I'm glad to tell you that actually we had almost no death in someone who wanted to continue full treatment. We had 3 deaths in our ICU, but all of those people were in comfort measures because they had pre-existing illnesses and they didn't want to continue. Yes, it takes long. Yeah, the intubation, the people who are on mechanical ventilation support are lasting way more than what we have seen with similar etiologies for ARDS. But it is fair to expect and to ramp up our specialty care. So whether it's advanced ARDS or something like ECMO, we actually have now one patient who's being supported by extracorporeal membrane oxygenator ECMO, which at the beginning was thought to be not effective for COVID, but later actually, yes, it is being employed and all over the country, and our experience is very positive.
So the ECMO, sorry that cut out a little bit, but that's basically a heart-lung bypass. It requires a very special procedure. It's very invasive, but Dr. Almasri is the regional leader in the ECMO technologies through community regional. He's been one of the pioneers for us here in Fresno County. So that's great. Thank you for that.
Dr. Vohra?
Yes, sir.
I have a question. Vic Bedoyan, KFCF Radio.
Yes, sir.
As you know, as reported in the Fresno Bee, one of the workers at the Foster Farms chicken factory had coronavirus. And there's also the Darling meat plant in West Fresno. Are there any special measures or surveillance or testing planned for those kinds of plants or factories?
Yeah, great question. So we've been working with employers really since the very beginning of this to make sure that they understand safe practices related to work sites. As you know, at the end of March, we actually introduced, all of our counties in the Central Valley introduced some special screening measures even a couple of weeks before the CDC came out with their recommendations to make sure that employees were kept safe. And those screening measures included temperature checks as well as symptom checks and the use of social distancing whenever possible with these work sites. And we feel like that has actually been very effective in keeping these work sites as safe places. Beyond that, whenever we do have an employee who falls sick, we work very closely to make sure that not only their household contacts, but also all of their work contacts that are close contacts are identified and kept safe either with quarantine or with other procedures in place. And if they need to get tested, we do go ahead and test them as well. So that's kind of where the screening and the testing and the quarantine kind of all play a role. Each one of these work sites is a little bit different. And so there's really no blanket policy that can really account for all the different ways that people can get sick. But we are working with all of the area employers and they've done a really commendable job. Really all of the critical infrastructure industries have done a great job making sure that they're keeping their employees safe at the same time that they're serving the public. And they're really paving the way for allowing other businesses to come online. Like Dr. Paul says, I feel the same way. The term essential and non-essential is probably not as applicable as safe and not safe. And we want to make sure every single one of the employers that is coming online is safe so that they keep the public safe and they keep the employees safe as well. So we're working with all of them and we're learning from them as they learn from us about how to make sure that all of their employees stay safe. And I know Simon Paul has been doing the same thing in Madera County. Anything to add to that one, Simon?
Yeah, it's the same guidelines as far as staying safe. But like you mentioned, businesses are all very different, and actually workplaces can be really challenging environments that we don't know well and we're not used to working with. You know, there are machines that the only way you can operate is to have two people within a foot or two of each other, and how to protect people in that environment is challenging. So we really need the help of, you know, CalOcean, other groups to come up with guidelines, environmental controls, airflow controls, things like that are the issues that matter in workplaces. That you know, the principles are the same. You need to have distancing between people, but how to implement that in different factories and different settings is really challenging.
Great, thank you.
Thank you very much.
Sure, thank you. All right, couple more questions. Oh, somebody.
Yeah, I have one more thing for you and/or Dr. Paul, which is basically what I saw in Santa Clara County. You've probably seen that they found some cases that predated their known deaths. I'm wondering if that's something that either of you would ask your county coroners to work on, to check on.
I think it got here a lot later, you know, moved from there to here. So I haven't seen, you know, numbers of, you know, increased deaths from pneumonia in the hospital here or something to make me think of which cases to go look for, because the numbers here are small. There might be larger numbers in Fresno County and one might get a hint of it. But I think it traveled here from there, most likely, just in the way you see the numbers in hospitalizations increasing here after it did there. So I don't think we'd find something earlier here than they found there, but it's an interesting question.
I think we have started seeing actually a uptake in pneumonia and ARDS type of viral pneumonia with negative workup in probably late November, early December, and I wonder if some of those was in essentially COVID. I also learned from some of our emergency medicine colleagues that there was an uptake of respiratory-like illnesses visit to the ED. So I wouldn't be surprised if we discover later that we've had the virus months before it was officially announced.
Right. Yeah. And I think that's where the serology testing, once that gets worked out, we'll be able to answer a lot of those questions. I know that in the winter months, we were really talking about how the flu season was really bad this year, that perhaps the flu vaccine wasn't as effective. And maybe part of that reason was that some of these quote unquote flu-like illnesses might have been coronavirus. I mean, it's all conjecture until we know for sure with laboratory testing. But it is a very interesting set of findings from the serology testing that's being done in Santa Clara, and similar results coming from the LA area as well. So I really, like I've said before on these sessions, I can't wait to do population-based serology testing here whenever that becomes available to answer some of those questions.
Go
ahead.
Sorry, no. I was just going to say there was worse RSV this winter as well, I believe. So that could be conflated there.
Yeah.
We test for RSV. So it's part of our viral panel. We're talking about actually increased illnesses that all other tests came negative. So including human metapneumovirus. So influenza A, influenza B, RSV, and human metapneumovirus. So we're left with very few, and understanding that not every viral illness is corona, but this is just a possibility.
An interesting question from our Facebook feed. What is the process for grocery workers to protect them? I have a friend that was sent home and had a hard time getting tested because they were not covered by their insurance. So that's a complicated question, but I think an important one, because I think a lot of people are in that same boat. Let me just answer the first part of that, which is the part about protecting grocery workers. So again, that goes back to employer screening. Every day, every employer in the county has to do screening, meaning temperature checks, as well as asking that the employees, whether they have symptoms of what we call febrile respiratory illness, meaning that do they have coughing, do they have shortness of breath, do they have other symptoms that could be COVID-19. And if they do, then they are basically asked to go home and start recuperating right away. If they don't, then they're allowed to work for that day. But the understanding is if they fall sick in the middle of the day, that they should ask to go home right away as well. So sometimes when an employee is asked to go home, it's because that symptomatic screening that gets done at the beginning of each workday raised some issues about how that person would be able to work or not. Another reason why somebody might be asked to stay home is that if they are a close contact of someone who actually has COVID-19, then they basically need to quarantine at home as well. So that's basically where quarantine orders come in, is if you are at risk for catching COVID-19 because someone around you, what we call a close contact, was diagnosed with the COVID-19, then our health department will recommend that you stay home for 14 days. And that is several-fold. One is to protect you and make sure that you have as much rest and recuperation that you need just in case you get sick. But really, it's also to protect everyone else, because we know that this COVID-19 can be an asymptomatic infection that you may actually have the germ and be transmitting it, even though you yourself feel fine. And we just want to wait 14 days before we ask people to come back to work. If you do come back to work during that quarantine period, because you're considered kind of an essential worker and they just can't allow you to stay home and still fulfill the functions of that profession, then they're going to ask you to come back to work and wear a mask during that time. And so that's kind of what we've been doing with some of our essential workers, some of our essential professions. And those are all guidelines that are set by the Centers for Disease Control and Prevention. So I know that that's complicated, but those are the kinds of issues that my team here at Public Health works with all the time. And we work very closely with employee health at all of the hospitals, really at all of the major employers that have employee health programs. We really work on these protocols to make sure that we're keeping all of the employees as safe as possible, but also ensuring that people who can go to work are able to go to work as soon as they're cleared. Regarding the getting tested and not having insurance, I'm hoping either Tom or Jim can speak to that, because I think that that's another myth or another piece of misinformation that's out there, that if you don't have insurance that you can't get tested for COVID. And I hope that one of you can help clear that one
up. My understanding from listening to our president as well as our billing company is that testing will be free. If you are uninsured and you come to the ER for concerns about COVID and we test you for COVID, I am told from our experts that you will not be billed.
Yeah, and that's pretty much that's pretty much the information that we have, is that the testing will be covered. That really shouldn't stop you from going ahead and getting tested. If you have any questions about that, reach out to us. We actually have our helpline, that 211 helpline that Lindsay was talking about. That's actually what that is set up to do, is to answer questions just like that and make sure that you have all the information that you need to make the right decisions about going ahead and getting tested and anything else that you need. So call 211. If they're not able to help you, then you can also call Public Health at 600-3332, and we can basically help you get tested at the time that you need it. You've asked before, and I've got my team working on it. We're creating a directory, and I hope Simon Paul and his team can create a directory for Madeira as well. We're going to create a directory that gives you really a map of all the testing centers, their hours, what the populations that they serve are, so that you can know ahead of time exactly where you can go get tested. Like I said, this is changing very quickly. It's really a moving, shape-shifting sort of picture, just because new testing is coming online all the time. So we will try to stay on top of it as much as we can. But we will actually have a resource for you to where you will know, hopefully a very close by testing site that you could just call ahead, make an appointment, go in and get tested, or even sign up online with some of the resources that the state is providing. So again, the testing is going to get better and better. Please hang in there. In the meantime, if you need any of us, we're here for you to help you get through your testing challenges.
You guys are awesome. Thank you.
You're welcome. I think we'll take one more question or comment, and then wrap it up. My communications team has done an awesome job. They're saying sorry for the interruptions if you're experiencing interruptions in the Facebook. However, this full live town hall will be posted to our YouTube channel by later this evening, along with all of the statistics that we shared regarding case counts. And if you have any other questions, you can continue to email us, dph@Fresno County, California, fresnocountyca.gov. Call 211, use Lindsay's amazing resources and hotline, and contact us at any time if we can help you with any other questions or concerns. Thank you so much to all of my content experts and speakers. And thank you to our media partners and to all of you who are able to make time for us to ask these important questions. We really appreciate the support and the attention that we've gotten from all of you. And we look forward to your feedback. We hope that we can offer this again at a future time as this pandemic evolves and as we have more information to share. Have a wonderful weekend. Enjoy the nice weather. Call mom and dad, tell them that you love them, and have a great weekend. Thank you for joining us.
Thank you.
Appreciate it. Thank you.